Hello, Space Coast. I'm Ron Lighthall. Right now, I am in Christine Zonka's office with one of the great people here in our community, our state. It is an absolute pleasure to introduce you to Florida's top doc, the Surgeon General for the state of Florida, Dr. Ladapo. Doctor, it is an absolute pleasure to have you here in Brevard County, and you're going to be bringing some very exciting news for us. So, thank you for taking time out of your extremely busy schedule this time of year and addressing some of these programs we have coming to Brevard County.
Oh, thanks. Thank you, Ron. Well, I'm really happy to be here in Brevard County. And, I really like Brevard County. I'm in great admiration for the core program that we've developed here and that people here in the county are administering and providing to people with opioid overuse disorder and other substance abuse disorders. So it's a pleasure to be speaking with you.
This core program, now, one of the things I'm extremely proud to be a Brevardian and live here on the Space Coast. And the Space Coast is not without its dark side. And that being, of course, an epidemic that has absolutely gripped not just our area, but the entire country right now is going through something extremely painful for a lot of families. And information is critical to get out. And one of the things about that information are the resources. And you and your team have introduced this program that you have kind of started to roll out to address and stop that revolving door process of drug use and particularly in the opioid realm. Tell us a little bit about what CORE is fundamentally.
Sure. Yeah. So you're absolutely right. I mean, this country has had just a devastating problem with substance abuse. We see more than 100,000 Americans dying needlessly, completely avoidably due to overdose. So it's a tragedy. And of course, every one of those people leave behind loved ones. Oftentimes, they leave behind children, siblings, friends, other family members. It's incredibly devastating and painful and costly. And we've seen this developing over the last several years, worsening during the pandemic. And it's just had a tremendous toll on every state in the union. People have talked about different strategies to address it, and one of those has been providing medications for patients. But medications don't work in a vacuum. Patients have actual lives. They face lots of different types of stressors. They're at different points of readiness in terms of their openness to even receiving treatment. And there's more to it than medication, too. We know that for addiction, trauma, stress, those are major components that cause someone to be susceptible to addiction, that leads someone to have a difficult time stepping away from drugs and making decisions that are better in line with what they actually want from their lives. So there are a lot of things going on. And CORE brings those things together and puts them into a patient-oriented package that really maximizes the patient's chances of being successful. So when a patient, for example, overdoses or has decided that they are actually ready to receive help, the CORE program can step in. For a patient who overdoses, they're met in the emergency department by a peer counselor. They're met by someone who is either a psychologist, someone who's a therapist in addiction, and they're met by members of the emergency medical services team who are the first contact and often will have repeat contacts and will know other individuals who might be in similar circumstances to this particular individual. And those resources come together to try and help the patient who wants help get to help after the emergency department. That means the peer counseling, it means the peer support, it means the other social services that people sometimes find to be sources of stressors that are contributing to what makes it hard to step away from addiction. And it also means medication for patients who want medication. There's very good evidence that medication especially things like buprenorphine, are very, very helpful and very effective for people who are addicted and are struggling and want to get better. They are definitely effective for helping those people regain stability in their lives. And that stability means function.
This program started in the West Palm Beach area with huge success, and this was kind of like the basically the model that you're trying to roll out in some key areas
Yeah.
addressing the state of Florida. Inevitably, these programs can get expensive. The perpetrators that we're all now too familiar with
Right.
Purdue Pharma, the Sackler family,
Yeah.
the lawsuit, that money funded back to the state through the lawsuit is going to help fund a huge portion of this and minimize the taxpayer investment into these programs.
Yeah, yeah, that's right. That's absolutely right. And just to comment on something you said earlier, Ron, we are blessed to have Dr. Ken Shepke, who is an emergency medicine physician and also serves as Deputy Secretary of Health. So not only, I mean, I really have great admiration for our EMS guys and
The
gals.
front line.
Yeah, I have tremendous admiration for them. I have practiced as a hospital medicine doctor, so I get patients when they're stabilized, but they are there right where things are happening. No one knows what the heck is going on, and they're right there in the field. And Dr. Shepke brought that experience to help us optimize the structure of the core program as an emergency medicine doctor himself. So and that's why the program is so thoughtful. And in Florida style, it just makes sense. It makes it easier for people who want help to get help. The services are certainly costly because they are intensive. And fortunately, we do have opioid settlement money that is helping support core and the expansion. We've also received money from lawmakers here in Florida for it. It's one of these problems. I mean, it's just tremendously devastating. It's a good thing that pharma is paying for the program. I mean, they've made untold billions
Countless.
from,
It's unreal.
unfortunately, supporting therapy that oftentimes was not helpful for patients. I mean, so often, some patients do benefit from these medications, but you really see in clinical trials that for most conditions, including the conditions that doctors were historically prescribing them for, the patients who receive the opioids are no better and sometimes worse off than
Mm-hmm.
people who are taking over-the-counter medication. And it's because pain is complex. It's not a broken bone. There's the sensation, but there's also how that sensation is received and interpreted by the brain. So it's complicated. And the medications just for most illnesses are not really providing improved benefits compared to over-the-counter medications. So it's good that they'll be paying for it, and it's a costly condition anyway. So we take that into account. A lot of
Right.
times these patients accrue tremendous amount of dollars in terms of law enforcement, in terms of acute hospital care, in terms of other conditions too. So it's a social cost also.
One of the things here on the Space Coast that we've always had a great amount of pride in is the fact that we have an immense pool of resources. And when there's a need, and we do everything we can to fill that need. In the event of a car accident and you're airlifted, you're going to a specialized trauma unit. Not every hospital is going to be equipped for a trauma unit. So you're going to go to a specialized hospital. And that's kind of the mentality you guys have designing
Right.
this program, that you're going to have specific hospitals strategically placed that are specifically set up, designed, and have the right equipment and personnel on staff. So you may not immediately, in an event or an episode, when the EMS shows up and they inject the Narcan, they're immediately going to assess that situation, but you may not go to absolutely the, let's say, closest hospital. You're going to go to the most appropriate hospital. That's a big leap in the way that the system is working.
You're absolutely right. And I like your analogy too, because you do have specialized hospitals for special conditions. And we know that patients with those special conditions do better at the specialized hospitals. It just makes sense. And we're seeing the same model applied here. And it requires coordination at multiple levels. These core programs we have in Florida, they're working with the local EMS teams. They're working at the county level. They're obviously coordinating with us at the state level. They're coordinating with private providers of some of these residential programs and non-residential outpatient programs for addiction. So there's a lot of coordination, and that creates the right type of care, and those centers are recognized as specialty centers
Mhm.
in core counties for that type of care.
This is a very big deal, not just for Brevard County, but the state of Florida, that could serve as a model nationwide on how we care. And one of the battles that you have, and again, that the moniker of being general, there's so many different battles. Is one of the things is misinformation, disinformation, bad information, and reprogramming the thought process of the general public of the immediate victim mentality versus somebody who has found themselves in this situation. You've changed a lot of the language, the vernacular's changed, the treatment of the patients has changed, which all ultimately helps that process to get over the addiction process.
Yeah, I think that is really important because, we're I've spoken about spirituality before. I mean, we are all images of God. We are products of divinity, and we have autonomy, and we each have power. Each and every one of us has power, and each and every one of us has a purpose on this world. And my hope with CORE and with anyone who is dealing with addiction is that they do make that decision to seek help. And that's no one can force anyone to want
Mm-hmm.
to seek help. That's a decision that individuals have to make.
Now, on that note, with the core program, and it seems like what you have to have an episode in order to get in the program. It can just simply take a phone call. I mean, you
That's
can
correct.
voluntarily go in, which is another big
Right.
deal. You don't have to wait to a critical moment to get in. You can self-identify and say, hey, I may have a problem with opioids, heroin, whether it's synthetic or natural. And we've seen the waves. We saw the 90s, then we saw the in the mid 2000s the heroin epidemic. Now it seems to be more of the synthetic
Yeah.
type stuff that's really permeated society, is more of the synthetic, which is more dangerous on so many levels. But again, coming back to that, you can pick up the phone and say, hey, I may have a problem. I want to try this program, get me off this wagon.
That's exactly right. You don't have to come in through the emergency department. Obviously, the people who come into the emergency department are the people who face the highest risk of coming in for the last time to the emergency department in terms of dying, having a fatal overdose. But you don't have to come into the emergency department. So people who aren't at that hyperacute point can still contact our core services and get a referral and become part of the program and take advantage of the resources that the program offers.
And having you here today is a huge honor for not only myself, but have you here in Brevard County to address these needs and announce those hospitals and the programs. So thank you so much for coming out and taking time out of your schedule to make sure that we know about these programs. And of course, you're going to follow this up with of course, the information once these things roll out.
Yeah, that's absolutely right. And it's a pleasure to be out here. And yeah, the core is an excellent program. I believe it's going to be a great model for other states who are looking for effective strategies. And we're going to be following it up. We're collecting data. We want to see how the programs do. We want to see how the patients do. But I'm very confident. It just makes sense. When people want help, if you're able to make it easier for them to gain access to resources that are effective,
Right.
they're going to do better.
Even in its earliest data, I mean, there's already 300 lives that are effectively saved in its short tenure thus far, which
Yeah.
is phenomenal.
Yeah.
And as valuable as every life is, it's the families. That's that much less trauma that
Oh
a
yeah,
family has to go
tremendous.
through.
Oh,
A parent, a child,
yeah.
and again, there's no social construct of who this affects. It just literally is everybody. But we're going to let you get to your meeting. We're going to have so much information as this program rolls out. And hopefully, you and I will have another discussion in a year or so when the data comes back, and it's really rolling and trending very nicely right now as
Yeah.
far as getting the results you're hoping for.
Yeah, it sure is. It
All
sure
right.
is. Yeah.
Thank you so much
Okay,
for
yeah.
joining us. It is
Thanks,
an
Ron.
absolute pleasure once again. The Sunshine State's top doc, the Surgeon General, meeting with us here today, and we want to thank you for tuning in. And we're going to have so much information about this brand new program that we're going to be rolling out that is going to hopefully curb and really tackle the opioid and any of the addiction processes. So if you or somebody you love is affected with that, we definitely encourage you start reaching out now, and we'll get you those appropriate programs. Thank you for joining us.